Hi, I'm Eric Levine. I'm an associate principal with Avalere Health, here to talk a little bit about an overview of our company and our work in risk adjustment strategy optimization. So just a little bit about Avalere. We're an healthcare advisory services firm. We only work in the healthcare space, and we work with clients across the healthcare ecosystem. So we work with health plans, pharmacy benefits managers, integrated delivery networks. We also work with healthcare services vendors, so vendors working with health plans and selling to health plans, health systems, hospitals, providers. We also work with specialty pharmacy and distributors, trade organizations like patient groups and also other trades, and then life science companies, pharmaceutical manufacturers, biopharma, and medical devices and diagnostics. Our company overall, we have over 1,500 full-time employees. We were founded in 2000, and then we've evolved and are now part of a broader organization who've adopted the title of Avalere Health, so they've rebranded. Uh, the broader parent company is a global organization that has advisory services, medical writing, and also marketing services. Within Avalere, we have four departments or four verticals. We have our state and federal policy, we have our data analytics and evidence and strategy team, financial services, and we also have a commercialization strategy team. So as far as our health plans work with Avalere, we work across the ecosystem with plans from policy analytics and policy modeling. Being in the DC space, we're very in tune with DC federal policy and also work on state policy. We work on corporate strategy. We work on data analytics and performance benchmarking, risk adjustment, strategy and operations optimization. We also work in other areas of operational compliance and quality improvement. And we also support health plans with RFP support, value proposition, and growth, specifically in the Medicaid space. So we bring a wealth of expertise in the risk adjustment space. Formerly, we were part of Inovalon, which is a risk adjustment shop. They do processing and submissions for risk adjustment. We also have experts who have been many years in the risk adjustment space, both on the government side and the plan side. So I'll just share a few case studies to highlight how we partner with plans. And we don't offer productized solutions. We're really customized to the client. So we provide those strategic advisory services and operational reviews that are tailored to the client's needs. So one example, we worked with a large national health plan and Medicare Advantage around the time when CMS was transitioning from the RAP system to the EDS system in risk adjustment. So they were previously using the risk adjustment processing system for plan submissions, where plans would package up their data into a standard file format, send it to CMS for risk adjustment purposes. And they were moving to the encounter-based system where plans would be sending their actual encounters. And there were some other changes along with this, but the plan wanted to ensure that its processes would transfer well and scale with the new system. So we did an independent third-party review of this plan where we collected documentation to start with the desk review. So we requested policies, procedures, job descriptions, training aids, internal presentations or decks, provider education around risk adjustment. So all sorts of documentation related to risk adjustment to conduct a review. Then what we did was we developed a compliance matrix, which outlined each of the new requirements under the EDS system. And we mapped the client's policies and procedures to that matrix where we were able to identify where the client met the requirements or where their documentation showed gaps, where they either didn't have the documentation or didn't sufficiently address the new changes. Then the next layer we did was interviews. So we went to the client and interviewed key individuals responsible for the risk adjustment program from end to end. So we talked with employees in the data business unit who were packaging up the data, sending it off and transmitting it. We spoke to the provider teams who were doing the provider education. We spoke with the quality and clinical teams to understand how the risk adjustment and the quality programs were interfacing to see if there were synergies or gaps in communication. So at each step of the process, we spoke with staff and we did a thorough review of identifying strengths and areas that how well suited that area was to support the new transition to EDS, and then also where their gaps were. And for where there were gaps, we provided a directional measurement of the magnitude of that gap. Was it a large gap, a medium gap, or a small gap? And then what were the consequences of each gap? Was it a compliance gap? Was going to be at risk of some sort of negative finding, or was it more of an operational gap where uh, it would it's less efficient, or there were things that could be done better but weren't necessarily those compliance risks? So we put together a report outlining those strengths and those gaps, and then we provided a roadmap of what the client should do from sort of the near term, midterm, and long term to close any gaps we found, prioritizing obviously those larger and compliance gaps for quicker resolution, and then gaps that maybe required more investment or were lower priority out towards the later years. The client really valued this because it provided that objective step back. I think there were a lot of moments where when we brought people together who were part of different parts of the process, they would talk about something they were doing, and someone else would say, "Oh, I didn't know you were doing that," or "That's not how we take and use what you passed to us. We actually do it this way." And so it really broke down silos with the client. And through this process, through our recommendations, our client came back to us and let us know that through some of the technical support and adjustments, they actually saw a $90 million increase in revenue because there were whole data streams that they weren't prepared to submit to CMS for risk adjustment, which meant their risk scores weren't as accurate and fully capturing some of the diagnoses that were coming through some of the supplemental claims and risk adjustment. And so through that, they were actually able to make sure their scores were going to be accurately reflected in this new EDS world as opposed to the RAPS world. In another project, we did a similar exercise with this client, but then we also did an assessment of their data process as it related to risk adjustment. So the client were running their own risk adjustment data submissions, and we did an end-to-end analysis to identify steps along the data transmission process and make sure that data was flowing through it. Nothing was being dropped. So what we did was we identified 2 years dates of service and requested all the claims from the client at different steps. So we requested the source claims that the client was getting, both from providers and also from supplemental benefit providers, like its vision claims, home HRA claims. Then we asked for the 837 files, the MAO2 files, and the MAO4 files, which come back from CMS. So sort of intake, packaging to CMS, and return files from CMS. And we analyzed the claims through each step to compare from source to 837, looking at the two databases and identifying what claims fell out from step 1 to step 2, then from 837 to MAO2 and MAO2 to MAO4. So within each step, comparing the claims count, what was included on those claims. So then what we did was, one, we created files that had the missing claims. So which claims fell out, here are the claims, so that the client could then sort of go back, pull the claim and try to see, okay, where did this claim, why did it miss? Do we see it in our systems, and validate that it actually didn't make it through, or maybe it did. And then what we did was we calculated the potential revenue loss due to these claims that were being dropped out of the risk adjustment submission. So we ran the claims through the CMS HCC model to estimate what the PMPM revenue was, what the risk adjustment claims were, and the impact on that. And through that process, we identified, actually in 1 year of service, they were, through data loss, missing about $4 million in revenue. That next year, the problem only magnified, and they were missing $20 million. Luckily, when we did the project, they were able to recapture some of that. But through just 2 years, $24 million of revenue was missing because there was leakage in the data process. And we helped them root cause some of this. The client was running a code that someone in the organization had built and subsequently left, and they didn't have a good handle. So we tried to estimate, to say, from this step to this step, we actually noticed that something in your code is adding variables to the diagnosis code and causing it to be dropped. So things like that, so that they can go back, evaluate their code, and prevent this from happening. So this was a real value of the client, and I think sometimes clients think their processes are running smoothly, but they don't know what they don't know. So it's really helpful to be that independent reviewer and fully looking at their end to end. And it also working with all of their vendor data, because each vendor is only responsible for the data they're submitting, but the plan is ultimately trying to get all the data together. And so to be that partner with the plan to evaluate their data holistically is really valuable. So those are just a couple of solutions. I hope we conveyed that with each client, we sort of go in to identify what are their unique needs as it relates to risk adjustment and quality, because we've been working with clients on the synergy between the two, making sure that they're effectively managing all of their member and provider facing activities to support an optimal risk adjustment strategy.